Moving on, I would like to introduce Deborah Coppell, who is a senior social worker here at Perlmutter Cancer Center, and she's going to talk to us about the supportive service program, what they do, and also introduce our special guest speaker today, who is a patient survivor. So let's welcome Debbie.
Hi, thank you. So I want to talk a little bit about supportive services and my role on the melanoma team. Of course, coping with cancer can be a very daunting experience, not only physically, but emotionally as well. And as the oncology social worker on the team, my role is to focus on the patient's emotional well-being by helping the individual who is living with cancer to improve his or her quality of life, manage anxiety and fear, and find hope. I provide counseling to patients and their families to assist them in accepting new roles and responsibilities. I serve as a liaison to the medical team, and I connect patients to the resources they need to better negotiate the healthcare system. I also help patients to access the support they need, whether it's emotional support or concrete services. Support can take the form of referral to community resources, accessing legal support, encouraging participation in a support group, or helping the patient to access complementary therapies. As a member of the melanoma team, I work with the other medical professionals to help patients get the information they need to make informed choices about their care. I also help to bolster the patient's supports so that he or she is better able to manage the day-to-day challenges of living with cancer. And finally, my role is to validate the patient and to ensure that the patient and family feel listened to and emotionally supported. That being said, I would like to introduce Nathan Nedorosek, who will share his story with us. Thank you.
Hi. I just found out about this yesterday, so I don't have any slides. But I guess I can just share a bit of my story and how I got here, and I guess answer some questions. Is that what we're doing? Okay. I have metastatic melanoma, stage 4, and I'm currently a patient with Dr. Pavlik and Dr. Stein. I've been on a BRAF MEK inhibitor for the past 5 years, since 2011. Originally, the melanoma developed in 1996 on my shoulder as a mole that I had removed, and my left shoulder, and also my lymph nodes biopsied then. They were negative, and I didn't do any follow-up chemotherapy or anything like that. 13 years later, I found a lump in my armpit that turned out to be a 7-centimeter tumor, and I think at that point it was stage 3. I came to NYU. Dr. Shapiro removed the tumor, and I did a month of radiation, and I think that I did the ipilimumab after that. I did a 4 weeks of interferon, which was horrible. 12 months after that, we found tumors in my neck and in my abdomen. There's a 7-centimeter tumor in my abdomen and smaller tumors in my neck. And we started the BRAF MEK inhibitor clinical trial. Ups and downs, lefts and rights from there. It was an interesting journey of side effects and unknowns. All of the all the side effects Dr. Pavlik mentioned on the in the slides are real and worse, actually. But they've slowly subsided. I think I spent about 12 months just not being able to work and kind of not doing much. But I use that time as more of a self-reflection kind of inner journey to find out a little bit about myself. And they gradually got better, the side effects, and now I'm here and living a fairly normal life.